Hey everyone, how are you? Welcome to another videos for MRCS exam. This is the question and answer session, and this session is very important for passing the MRCS exam with carrying a good marks. So here the question: a 62 years old man present with arm weakness on examination. He has a weakness of elbow extension and loss of sensation of dorsal aspect of the first digit. What is the site of the most likely underlying defect here? So after reading, we have to find out the key points to answer the question. Here the 62 years old woman present with 62 years old man present with arm weakness. On examination, he has weakness of the elbow extension. That means elbow extension is loss of sensation on the dorsal aspect of the first digit. What is the site of the most likely underlying defect? So here the options are axillary nerve, median nerve, ulnar nerve, radial nerve, and musculocutaneous nerve. So we have to find out one of the option which is compatible with the answer, or which will be the answer. So first of all, we can see the weakness of the elbow extension. So we have to find out the extensor group of the muscle of the elbow, and loss of sensation of the dorsal aspect of the first digit. This is the hand. So we have to find out the sensory supply of the dorsal aspect of the hand. Then it will be very easy for us of the answer. So here we can see this is the arm, and in this picture here is the extensor aspect of the elbow, and here we can see the different group of the muscle which is attached to this extensor group of the elbow. And here we can see the important nerve is going through. This is the radial nerve. So radial nerve is very close to the elbow joint, so there is every possible that the radial nerve supplies the extensor of the elbow joint. Actually the radial nerve, it supplies all the muscles of the extensor group of the arm and forearm. So radial nerve, it supplies all the extensor muscle of the arm, forearm. And in this picture we can see this is the first digit, and we can see the first digit is supplied by the radial nerve, because radial nerve from here it supplies almost there, and it supplies this area. So the large area, the sensory innervation is given by the radial nerve, and the radial nerve, it supplies the first digit dorsal aspect. And we also can see there is the ulnar nerve supplies in this area, that is 1.5 finger, and median nerve dorsal aspect, it supplies the including the nail bed and part of the digit. In here we can see the radial nerve. If radial nerve affected, what would be here? In the shoulder, it would be long head of the triceps will be affected, and minor effect on shoulder stability of the abduction. That means abduction is similar, a minimum portion is affected. Then in the arm, it supplies the triceps and loss of the elbow extension. In the question, they denote that there is loss of the or reduce the elbow extension. So here this is supplied by the radial nerve, and here we can see in the first digit it is also supplied by the radial nerve. So our answer is radial nerve. And here we can see in the forearm, it supplies the supinator, brachioradialis, extensor carpi longus, and brevis. And if paralysis occurs here, then weakening of the supination and of the prone hand and elbow flexion in the mid prone position. So here our final answer is radial nerve, because radial nerve, it causes the elbow extension, and it also gives innervation of the dorsal aspect of the first digit. So our answer is radial nerve. Other, we can see the axillary nerve, which supplies the upper part, and it supplies the deltoid area. The median nerve, which lies in the flexor aspect of the forearm, and ulnar nerve, it also lies in the flexor part of the forearm. Actually it is the medial part of the forearm, and the median nerve, it is supplies the lateral part of the forearm. And the musculocutaneous nerve, it is actually the solely nerve of the arm muscles, and it also provides cutaneous innervation in the forearm. So our final answer is radial nerve. Thank you all.